Updating our breaking news this morning, President Trump and First Lady Melania Trump have tested positive for the coronavirus. The news comes after the president attended several events this week, including this packed rally in Duluth, Minnesota, where the president tossed hats to the crowd. The president and First Lady are now in isolation. And joining us now live is Philadelphia Health Commissioner Dr. Thomas Farley. Good morning, Dr. Farley.
Good morning.
So we originally planned to speak with you about Philadelphia expanding its indoor restaurant capacity, but we'd be remiss if we didn't first get your thoughts on these major developments. So explain the process. Now that the President and First Lady have tested positive, what do the next 2 weeks look like for them?
Well, first, let me just wish the President and the First Lady well. Certainly, given his age, he's at some level of risk, but most people do recover with this infection. Let's hope that is the case. Our policy for isolation and quarantine is that the President and the First Lady should be in isolation. It's away from people, generally for about 10 days, but it depends on whether they develop symptoms, and if so, how long those symptoms last. And then people who have been exposed to them, that's within 6 feet for more than 15 minutes, need to go in quarantine for 14 days from the last time they had that exposure.
So you mentioned the president's age. He's 74 years old. According to his last checkup, he falls into the obese category. What is the increased risk that people like that would be dealing with now that he's tested positive?
Yeah, I can't put a number on it, but certainly most people who have a serious infection tend to be older. But most older people still recover completely from this infection. Again, let's hope that the President and First Lady are in those categories like most people at their age.
His aide, Hope Hicks, had reported not feeling well on Wednesday. What's the timeline for this illness? Because everyone's, a little confused as far as from contracting the virus to showing symptoms. What normally are we saying?
On average, the people, from the time when they're exposed to the time they develop symptoms, it's about 4 to 6 days for most people. And then the illness can run its course. It could be not having illness at all, no symptoms at all, or it can have symptoms that could last a week or more. So it's quite variable. I'm sure the President is tested frequently. And so let's hope they pick it up early, and so if he does develop any symptoms, he can get rapid treatment.
So now back to the original reason you're joining us. Starting today, restaurants in Philadelphia will be allowed to offer indoor dining at up to 50% capacity. This is a sign that the numbers are heading in the right direction here?
Yeah, we have seen a decrease in the number of cases from September to August. We've been about the lowest we've been since early March as far as the number of tests per day and the percent of tests that are positive. And so we do think that we could cautiously increase the number of people who could eat indoors. There's still a lot of precautions everyone needs to take, and the restaurants have to put in place a lot of safety procedures to protect those that are indoors. And we're encouraging restaurants to continue to allow people to eat outdoors, and for people to eat outdoors if they can. We're still living with this virus, as you see with the example of the President, so we all still need to be very careful. But yes, we can take that step, and let's hope that more people in the restaurant industry can get back to work as a result of that.
So speaking of the guidance that you're giving restaurants, what does that include for indoor dining besides just spreading people out, 6 feet apart?
Yeah, so a table can have no more than 4 seats, and that's to encourage people to only be eating with their household members. We don't want people eating with friends because that provides an opportunity of spread. Then all the servers need to wear masks and face shields because the servers are going to be exposed to a lot of people who are dining without masks. Those are the key things.
With regards to numbers, how do you think Philadelphia is doing overall in comparison to other locations? And what else will health officials be watching closely over the next few weeks now that there's the change of seasons? We've got the holidays coming up soon.
Overall, our case counts are on the low side. They're far higher than I would like them to be, but they're on the low side. And we're always watching them to see what direction they move in. As people go inside and the air gets drier, there is a concern that, like other respiratory viruses, COVID could spread more. And so we're going to watch closely the number of cases we see per day and the percent of people who test that are positive. And if those start moving upward, then we will consider reimposing some of the restrictions that we've released so far.